All right, let's talk about scar needling. Channels are electrical in nature, and scars are keloid tissues, so have higher resistance. So over time, the channels actually will start to deviate from the designated channels, basically, and that causes a lot of problem. So I don't use needles very often, but if there are scars at the appropriate time, I will actually do it. So what does it mean by appropriate time, right? So first thing I want to make sure is there's no pause, there's no dissociation, okay? So when a person is in pause mode or dissociation and we put a needle in, we're gonna make that condition even worse, okay? So the first thing to do is actually to make sure if there's any pending, that there's no pause and no dissociation condition, right? If there is, we need to resolve that. And I did talk about that in other videos. The second thing is they'll be able to connect to loving kindness, okay? They need to feel like there's a sense of thriving, right? If a person doesn't, really feel like their life has any meaning or any purpose, and they're pure survivors and they're not willing to thrive, needling through the scars honestly doesn't make too much difference. So before, and we talk about, we can mention scar sensing, and we can sense the flow of channels, right? For example, if a person has C-section or cancer, has breast removed, for example, and the first thing I will actually do is to say, hey, just have this voice in your heart that either whisper or say this or scream or shout or curse is like, I am going to thrive. I have a purpose. I am going to thrive. And you can feel, that the ring channel or the liver channel actually, vibrantly go through. Okay. To me, that's a prerequisite for me to do any scar needling. If a person is not able to do that and we don't feel any channel change, normally I will actually do more work. So sometimes it's necessary to, for example, if a person has been suppressed for a long time, there isn't enough anger, which is necessary for a sense of courage and thriving, for that to come back to life before we can do scar needling. Okay. So another thing is, once we start to needle the scars, we need to finish it. Okay. So if it's a C-section, I normally start from the ring channel, right, and go, for example, to the one side, right, finish, and then I'll start to the other side. Start to finish as quickly and as no mercy as we possibly can. Okay, there are certain scars that are extremely painful. Okay, scars around the hands, for example, and around the ankles, around knees, for example, knee replacement scars. C-section honestly is probably the least painful scars to needle. Okay, but anything along the hands which are filled with nerves, feet, for example, very, very painful, right? So that's why we need to prep the patient and make sure they are actually well connected. And during the scar needling, they are actually connected to, for example, loving kindness, and actually shine a light, try to brighten up the place that we're actually needling, okay? So this sense of brightening up or make that place warm or see lights or, channel, whatever you do, is actually to bring attention to, what we're needling, so that part of the body is fully associated, okay, instead of dissociation, right? So in order to do, to really go from start to finish in a very, very efficient and manner, right? No mercy, again, we're not going to say, oh, is it painful? Oh, sorry, so sorry. No. Once we start, we know it's going to be painful, right? If the person says, oh, there's a lot of pain, and say, yeah, I know, just curse at me or yell at me or whatever, you want to do, but we're going to continue, okay? So that, we connect to our patient's heart of gold, and we're just going to do this. So in order to do that, we need to put in the needles free form. Okay, we cannot say, we're going to use a guide tube and then, guide this in and this, and, it takes too much time, right? So in terms of equipment, this is what I do. Okay, so I normally use 1-inch needles, and I do have 1/2-inch needles in the clinic. And the reason for the 1/2-inch needle is there's some keloid tissue or the scar tissue that are very, very dry and very, very, very hard. Okay, and those are, I can find them, for example, in the hands, for example. Okay, and then one of the reasons is very, very poor circulation over time, and the scar dry up, and it's just like very, very thick, very, very hard. Okay, sometimes the open heart surgery has that as well. So you might find those, and that's when I use the 1/2-inch needles for that. Okay, the needles that I use are, for example, 32 gauge. Okay, 32 by 25. So this is 1 inch, right? And I do have 32 gauge in 1/2-inch as well. And I think that in general is fine, but you may want to order something that's a little bit thicker. For example, I don't know what's the next down, maybe 28 gauge or. And I know my teacher, Dr. JJ, actually has like 20 gauge. So those needles are like nails. Okay. So another thing is I buy these like 5 per pack. Okay. And the reason is, for example, I will actually needle, for example, a C-section scars every half chun. Okay. So a C-section scar like this long, probably requires 20 needles. Okay. So normally I will actually, so these are 5 per pack, and these are 5 pack each, right? So I actually get all 25 needles in my hands. I will actually get them all in my hands, and then I will start to needle. Okay. I don't want to in the middle and say, oh, okay, I gotta get more needles and stuff like that, right? So once we start, we finish it. Okay. It saves a lot of, otherwise the patient is like, it's not easy for anybody. Okay, so we get it done as fast as we can. Okay, so we need a lot of practice to do freehand and to be as efficient as we possibly can. Okay, so this is what I find most useful. Okay, so essentially I grab a Sharpie and I start to mark. Basically a toilet paper tube, okay, with a little bit of remaining toilet paper. Okay, how thick it is, how thick the toilet paper, right? I would say if you grab your skin, right, and that should be the thickness of how this toilet paper should be. Okay, so that's what I do. Okay, then I start to mark like. Scars, for example. Okay, for example, I would say this is an eyebrow surgery. Okay, this is a C-section scar. Okay, and this is a burn mark that greatly affects the channels. Okay. This is a open heart surgery. Okay. This diagonal is like a knee surgery scar, for example. Okay. And the guideline for inserting these needles is, first of all, it has to follow the channels. Okay, so it's not like, so if this is the scar and the channels are actually going up and down, we're gonna needle like this. Okay. Okay. So there's no turtling or going around and attack it from all angles. No, we just the goal for scar needling is to restore channels, to restore the proper flow of channels. So it's very, very important that we do that. Okay, another other scars that are like a mole, okay, a birthmark, an animal bite, for example. Okay, those are important scars to needle. Actually, very, very important scars to needle, especially animal bites. Once the pause and dissociations are resolved, okay. Very, very important. Otherwise, they carry a lot of fear, tremendous amount of fear in the scar. Okay. So once we mark these, so we have all the kind of the variations that we want to practice, right? And this is where this syringe wrap comes in place. Okay. So essentially, I do this. Okay. And I sort of wrap this best I can. Okay. That should be good. Okay. Now I have something that I can practice. Okay. So let me grab my needles. It's kind of hard to, because I need to hold this tube, right? But in actuality, I will have this and the patient is sitting down or laying down, right? And then I will insert all the needles. So the key is really, I will just do one at a time, okay? So the way I hold my needle, I don't know if it's easy to see, is actually to have my middle finger and my thumb to hold the needle first, okay? Very close to where the winding is, okay? Very, very close. And then I'll get my index finger in. So I'm actually bending the wire part a little bit, okay? So, and to me, this actually stiffens the needle a little bit and gives me a very good feel for what I'm doing, okay? So when I'm doing this, and then I basically find, for example, this scar, right? And I would just going in at 45 until I touch the tube, then I level it to be, to go, you know, because what we want to do at the end is actually to have the needle to go parallel with the skin, okay? So again, 45, around 45 going in, okay? And then boom. Okay. So let's say this is a open heart surgery scar and it's very wide, okay? So what I'll do is I will actually go zigzag. I will actually do this. I'll go to the other side and do the, basically at a very quite an acute angle. Okay, something like this. Okay. And if this scar is really wide, for example, I will actually put another roll in the center. Okay, something like that. Okay. So the direction of, you know, where do we put the needle in, right? For example, if this is open heart surgery and the head is here, okay, head is on the over here, the Ren channel actually comes up, right? So we want a needle from downstream. So the Ren channel comes up here, right? So this is upstream, right? So near the navel, that's the upstream, right? Ren 1 is the upstream. So what we want to do is to insert the needle from downstream. Okay, why? Because when there's excessive resistance, it's actually qi deficient all the way on the downstream side. So when we insert the needle on the downstream side where there's very little qi, it doesn't hurt a lot. Okay, but oftentimes the last few needles, like we're here and we're trying to puncture it, you know, from the scar to the healthy tissue, right? That needle will be so painful. Okay, why? Because now the qis are connected. Okay, all right. So same thing goes with C-sections and everything else. Okay, yeah. I think that's all I want to share. So scar needling is important to me. That's one of the next evolution for Chinese medicine. Okay, because there's so many surgeries out there. It's not funny, right? And people suffer because after surgery, their channels are not going right anymore, right? And they feel, you know, it's a terrible feeling when the channels are not going where they're supposed to go, right? So when we can offer scar needling really from our heart, it dramatically changed a person's life, including ours. Yeah. Thank you. Oh, to remove the needle, I put in the needle one at a time, right? But when I remove, I tend to go like 3 at a time or something like that, right? And then I'll toss it into a like a pill bottle or something like that. Let me go grab it. Okay. You know, like something like this. Okay, so this is my pill bottle for 1-inch needle. So I will just toss it in, close the cap. Okay, so this is nice and close to my body. Okay, I don't want to carry this needle bucket or something like that, right? And then try so hard, and it has 10,000 needles in there, right? And I'll try so hard to put it in, right? So this, nice and easy, okay? So I can remove, for example, there are 2 needles here. I would just remove them all at the same time. I will actually press down a little bit, okay? Very, very little, and then boom, out. And then put it in, okay? So a lot of, it's actually funny, right? So, the patient feels there are like 20 or 30 needles go in, right? But when I remove it, they feel like there's, 10, no more than 10. And they will say, are all the needles out? I said, yes, all the needles are out, okay? They're actually very happy about that. Yeah, thank you.